I'm going to be discussing the CentraLign and OcuLign systems. And during the docking process, as we know, just as Bill was explaining, there is the corneal vertex and then the position of the eye to allow for cyclotorsion. And with the 500, as a lot of you are familiar, what you're doing is you're looking at that meniscus. And so you line it up and you look at the meniscus, and you're still looking at the meniscus to make sure that the meniscus is well centered. But with the new CentraLign and OcuLign, it just makes it that much easier for you. And here, what I'm going to show you in just a moment, you'll see this little yellow spot and line, and what that is that's the CentraLign, and what that tells you is where to go to be centered. And so it looks like a little, like a lollipop, I guess, like a little line with a circle, and it'll just point you in the arrow the way where you want to align the system, and so it makes it really easy. And as you do that, you can then see, yes, my meniscus is centered, I'm feeling really good about it. And you'll see also, don't blink because you will miss it, you'll see that there's then the suction, this is real time, this isn't edited, and then the lenticle cut. When you look at the screen, on the left-hand side, there's a blue line, a blue arc, and then on the right-hand side, there's another blue arc. The suction is on the left, and then the actual treatment is on the right, and you'll see the treatment as the 9 seconds are going down, you'll see that blue line disappear. So just watch for those two things as well. And so here, there's the little yellow arrow, and what I'm doing is, you'll see that little yellow arrow that was in the corner, and I'm docking here. And again, this is real time. I've got suction, you could see that, and here we go, we're doing the cut. There goes the refractive cut, the side cut, here's the cap, and then there's the incision, and we're done. So super quick. And it just makes for a really, really nice centration. In addition to that, well, here is John Doan talking about his first number of patients and looking at the satisfaction of how well were you aligned, again, the ease of lenticle dissection, which we're talking about, an overall opinion of the case. I've been really, really happy. I find that it's that much easier. I mean, once you have the Visimax 500 and you get used to docking, it becomes pretty straightforward. Again, looking at the meniscus, this makes it really, really easy. I mean, it just takes, I think, all of the anxiety out of that. And then, as I said, you know you're aligned. The next thing is the OcuLign. And so there's CentraLign, which gets you centered, so you don't have to worry, am I off axis or does it look decentered, just as Bill was saying. The next is OcuLign. And what this is to account for any cyclorotation. Currently, and we'll show a video here, you do need to manually mark. But then you see those 3 lines there. What happens is you currently do the manual marks. This will be automated. That's in process. It's actually automated in other countries outside US. And so you have that, you dock, and then once you dock, you see these 3 lines. And then if you need to align your marks for any cyclotortion, if you need to, you just Z it really quickly, you know, and there is some flex there. It doesn't break suction. You just align then the 3 lines with your marks, and that works really, really well. And so that also makes it more automated, accounts. Here we go, and this is thanks to Dr. Wiley. This is marking, and so you still do need to manually mark, but then after you manually mark, you again go under the laser, you get that OcuLign, the 3 lines, to register with your manual marks. And again, that is going to be automated and is in fact outside US. So that works really, really well. And also takes the concerns out of some of the concerns I think that we had with the 500, which were, am I centered? How do I know I'm centered? I want to make sure I'm centered. And also for astigmatism correction, wanting to be sure that there isn't that cyclorotation. Again, looking at the Visumax 800, they're just saying that there is still right now the need for some adjustment here, but it makes it much more automated.